Please say what you see.
Yes, in the video, I can see a child. He is unconscious. He is not in the conscious state, but he is in a distressing from the start. But he was actually crying, but not able to take breath. So, according to by compiling all this, it is an attack of breath holding spells.
Any DD you want to keep?
Yeah, it could be any syncopal attack, or it could be any vasovagal attack, or reflex anoxic seizures.
Hmm. So in this video, actually, first what I can see a toddler who is on outdoor patient or home setting. It is not clear. The toddler is not any device attached, but the child is crying and distressed. When he crying, he hold his breath, and someone at the back try to comfort him. But the child is loss of consciousness for a moment, but then he again come back. There is no his color of lip that is go blue color. There is no any, and
Yeah, yeah,
for
yeah.
a few seconds there is stiffness of the arm, and he immediately regain his consciousness. So it is a case of like a seizure attack, DD on top, breath holding spells, reflex anoxic seizure, vasovagal attack, syncopal attack, then epilepsy. Okay, and cardiac cause also keep with that, cardiac cause, metabolic anything, hypoglycemia. Okay, what history you'd like to ask?
Yes, I would like to ask about the onset, course, and duration, and what are the aggravating factor for this? What are the precipitating factor for this condition, and if it has happened for the first time, or is it recurrent, or does is there any neurasis along with it?
Yes. So breath holding spell once come on history. It is a 2 years of age a child. There is sudden loss of consciousness. Then they take the history and come out that breath holding spell or reflex anoxis are like that DD. So all the history like onset, course, and durations, and any unconscious type or any seizure conversion. We ask what happened before, what during, and what after. Is there any video recording? What make it better and what make it worse? Is there any hungry, angry, pain, past time or recurrent occur? And any heart racing, passing urine after that, feeding habit, is he who's the eater? Then after his development and his education. Development, we need to ask family history of similar conditions, any trauma, any drugs, any investigation to be done. What examination you want to do?
Yeah, I would like to check for the patency of airway and breathing. Is he breathing, or matlab, what is the breathing of the child, and breathing rate, and circulation, and perfusion of the child, and what about the vitals, especially heart rate and respiratory rate, oxygen saturation, and I would like to examine the neurological and cardiac system of the child.
So the examination is that first airway, breathing, circulation. We know that it is a seizure. So Glasgow coma scales, vitals we do heart rate, blood pressure, respiration, oxygen saturation, hydration status, Antonio Fontanelli. And as it is a CNS related, so full neurological examination, cardiac examination, and developmental assessment. So we are doing ABC, GCS, hydration status, Antonio Fontanelli, then full neuro, cardio, and developmental assessment. What is the how can you manage this patient? Suppose it is a breath holding spells. Treatment you give.
Yeah, I would like stabilize the patient first. We'll check the RBS of the patient, and I will go for. Is there any? Is there? I would like to take a complete history, and
Yes.
yeah, what is that?
So first I will take the complete history, revise my note. I check the RBS if maintained. There is no need for investigation. It is a case of breath holding, except if recurrent occur, then full blood count, because anemia aggravate the condition. So it is recurrent occur and when anemia aggravate these conditions. I will start some red flags. Red flags. What are the red flags? That is after discussion with the consultant. If age is less than 6 months or more than 5 years. Okay. Then recurrent occur more than one per week. Duration is more than 1 minute. Associated with any chest pain and palpitation. Family history of similar condition or sudden infant death. So the red flag, RBS first I maintain. Then if needed, repeated occur, then full blood count. Otherwise, investigation not needed. Search the red flags, that is less than 6 months, more than 5 years. Recurrent occur more than one per month, more than 1 minute. Family history of any sudden death, any chest pain, similar condition, these are. If the family history of cardiac disease like hypertrophic obstructive cardiomyopathy or Parkinson, long Q2, we may proceed for cardiac investigation like ECG echo, involve the cardiologist. So if there is red flag for family history of cardiac disease or sudden infant death, the ECG echo you are doing. If anything related to drug, do the toxicology screen. If mother insists to do investigation in case of breath holding, the reassurance. Remember, the treatment is reassurance. Then I will give some advice. The advice is that when this attack occurs, stay calm. It is a benign conditions. Don't make mouth-to-mouth breathing, but only put in lateral recovery positions. So mouth-to-mouth breathing, we are not giving lateral recovery positions. Distract him. Modify home to cover the sharp furniture. So we distract him, we him calm down, and we think that nothing inside the mouth going from because aspiration is one of the dangerous things. So these are. So this is all about breath holding spells video stations. Thank you.
Okay, thank you, doctor.